Most service industries have already embraced technology. My bank can protect my privacy while I self-manage my finances from home. WestJet lets me choose a seat. Safeway knows my shopping and eating habits just by swiping my card. And I know it is possible for the Saskatchewan healthcare industry to also use information technology. Now patients use a website to find a surgeon with short wait times, or reputable information about their disease and treatment options, or use telehealth to save travel. Imagine what more is possible. If you can dream it, you can do it. Well, I think Saskatchewan can be the best place in the world to live and work, that we can be the best healthcare system in the world, that others will come to learn from us. I'm not on drugs, so why do I believe this? How do I know it's possible? Well, Don Berwick was also able to imagine perfection. He went on to describe in detail how someone, somewhere, was delivering on each of the specifications he had as a customer, but no one yet had been able to put it all together. I think Saskatchewan can be that someone. Because we have already put it all together for some patients, it took years of continuous small improvements, but now things are dramatically better for obstetrical patients. Women can say, I get exactly what I need and want, exactly when I need and want it. We have seen dramatic improvements for our most critically ill patients as well. Now families are considered a vital part of the care team, not unwelcome visitors. Wives spend the night at their husband's bedside. Families join the care team on rounds. We hear the voice of our patients and customers. And we draw on the strengths and passions of our own people as well. I know where I work, this is more than just a poster on the wall. It is about our conversations around expectations, and it is meaning every day for us. This is how we show we care about patients and each other. I know the pride of being part of a great team, to be able to feel successful at work and go home every day and tell a story of how I made a difference in a patient's life. Imagine the power of all 40,000 healthcare workers in this province feeling that same way. Others have gone from good to great, and I know it is possible to deliver better outcomes and better value to benefit the patients and citizens of this province. I know our Premier, our health ministers, our deputy, and other leaders believe it is possible too. If Regina Mason can do it, so can we. Lean methodology is the basis for the British Improvement Program, known here as Releasing Time to Care. In 2008, we went to England to see how they were able to transform care on medical and surgical wards. And if it was possible there, we thought it might be possible here too. And it was. Releasing Time to Care has now been implemented on every medical and surgical ward in this province. The people who did the work continue to use the improvement skills they learned, and I still see safety crosses and run charts and daily huddles at performance boards when I do Gemba walks on our wards. Leading change is fun, but a little dangerous too. I learned phrases like, from the middle, all change is a disaster, and quality improvement is not for the faint of heart. But we learned that large-scale change is possible in Britain and here in Saskatchewan. We're still in the midst of another province-wide large-scale change. I know it is possible to deliver sooner, safer, smarter care to surgical patients. Our challenge now is to do it in primary care and fulfill this promise for every patient in our province. Standard work, mistake proofing, waste elimination, these are some of our new tools, and this will soon be the way we do things around here, our new culture. Because I know it is even possible to change culture. It happens when leaders change what they do. Quality as a business strategy was where leaders started thinking and behaving differently about measurement and organizational excellence. We had hundreds of Saskatchewan leaders in one room learning what was possible elsewhere in the world. And we wondered how close we came to being best possible. Now we are much better at knowing how we are doing and knowing if our efforts to improve are working. We are behaving as one system and aligning our priorities. Transparency and accountability have skyrocketed. And if you don't believe me, come to our weekly visibility wall walk. Change is not easy. This is long, hard work, but here's what I absolutely know. The people in this room and this province are up to the task. We are willing to push this boulder up the hill, or to be ready with a wedge when someone needs a little rest, or to celebrate every inch of progress. We're willing because our loved ones are the next patients we care for. Our youth are the next ones we train to take our place, and our neighbors rely on us to spend their tax dollars wisely. They need to know we will never stop trying to make things better. I can imagine changing the world for 1 million patients. I can imagine others coming to learn from us about what is possible, and I can easily imagine Saskatchewan being the best place to live and work. I know you can imagine it too, and that's why I know it is also possible. Thank you.